So, a very good morning to everyone. I hope I am clearly audible and visible to all. A very good morning to all. All of you have got the links to join, I think. है ना? Someone is asking a question in Telegram group that is egurukul enough? Yes, egurukul is the most optimum. It will give you the most optimum thing to clear up your exams with 100% speed and with 100% accuracy. You will be able to solve your questions as far as DBMCI faculties are concerned. Okay. Have that confidence within you that you are at the correct place and you will get the correct thing and the accurate thing and the optimum thing to clear up your exams. Your target should be very clear. Why we are sitting right now in the morning at this place with our systems, just to clear up our exams. So that is the single most target of yours also and mine also. So as far as my subject is concerned, I will cover all the important aspects so that you are well versed with all the 12 to 13 questions which come from my subject. I will make you sound enough. Giving 1 to 2 minutes for all the students to join. There might be few students who are new to the platform. So giving 1 to 2 minutes for all of you to get settled, and then we will start. So greetings to all. Good morning to all. Namaskaram. Suprabhatam, Vanakkam, Assalamu alaikum, Shashriyakal, Ram Ram. Greetings to all. So this session is live on YouTube also. So there also the students will be putting their queries. So I will keep a track of all the queries in Telegram group as well as YouTube group for the first hour, first session. So I hope we are good to go. शुरू करें? Good morning, Ji. Good morning to everyone. So guys, clearly audible and visible, I think. Chalo, let us begin with. So what we are going to cover is, let me tell you a few lines about myself. Myself, Dr. Vishwajeet Singh. I'm your faculty for FMT subject in DBMCI and egurukul platform. I've done my MD Forensic from UCMS and GTB Hospital, Delhi, where I have conducted and supervised around 10,000 autopsies, almost more than 10,000. So those cases are actually the cases and the stories which I will be using throughout my session to make the subject simple and interesting. So first of all, we will cover the basics of the subject. So as to what all important things are asked from the basics. So let us start our subject. So let us start with the basics, means the important areas which are asked from definition areas, important definition areas. So as to what do you mean by the word forensic medicine itself, first of all. You all will make notes with me. Okay. We both will be doing the hard work and that will give us very good ranks in our exams. So what do you mean by forensic medicine? This is application of medicine in law. This you must have read during your prof. Now what is the essence of this word? The essence of this word is that as a doctor, you should be able to comment upon Whenever a case is brought to casualty, you should be able to comment upon natural causes of death and unnatural causes of death. Natural and unnatural. Death can be natural as well as unnatural. Natural causes will be like cases dying due to coronary artery disease, due to atherosclerosis of coronary vessels. So yes, that will be a natural cause of death. Like for example, coronary artery disease. What can be the unnatural scenarios where a person will die? Unnatural scenarios can be, death can be accidental, like cases of fall from height. Death can be suicidal also. Someone has consumed a poison or someone has did the act of hanging. So those are suicidal mechanisms leading to death. And death can be homicidal also. Homicide means to kill a person. Homicide means to kill a person. So as a doctor, I should be able to take out heart from the thoracic cavity, and I should be able to look at the anatomical location of LAD, LCX and RCA, and I will dissect them. And then if I see blockage of coronaries, like in this image, if I see the blockage of LAD like this, the lumen has become pinpoint, I will give my cause of death as coronary artery disease. This is application of medical science knowledge, anatomy knowledge, pathology knowledge in law to give my cause of death. So what is the purpose of doing autopsy? What is the purpose of doing autopsy? The purpose of autopsy is to derive cause of death. This I will be using the short form COD for cause of death. Another purpose of autopsy is time since death estimation, which we do with the help of post-mortem changes. The different changes which are seen in a dead body after somatic death, like changes in eyes, rigor mortis changes, algor mortis, livor mortis, all that we will cover in thanatology chapter or post-mortem changes. Then another purpose of autopsy is identification. So this is a separate chapter also now. So that is why these three chapters, injuries chapter to help us estimate our cause of death, post-mortem changes chapter to help us estimate our time since death, and identification chapter, in total, they are three most important chapters. They serve the purpose of autopsy. So what is forensic medicine? Application of medical science knowledge in law to derive the cause of death. Okay. Now come to second definition. The second definition is of medical jurisprudence. With that definition, I will be covering MTP Act 2021. So let us start with the second definition, that is medical jurisprudence. Jurisprudence word, literal meaning of jurisprudence word is law, and medical jurisprudence is application of law in medicine to be done by doctors. Now as doctors, we should have knowledge of certain laws. Means they will be important laws from where questions will be picked. So our smartness will be to at least cover those important acts or laws, and laws are best taught by forensic people. Yes. So let us see application of law in medicine. Like for example, every doctor should have knowledge of MTP Act 2021. And you know, medical termination of pregnancy can be done by medical methods by using drugs like mifepristone and misoprostol combination day 1, day 3. Then after about 9 weeks, you have to apply surgical methods of medical abortion. Okay. So according to MTP Act, what are the important indications? What are the important doctors who can do MTP? Let us cover those aspects from where questions are asked. And recently in FMG exams held recently in January month itself, so there were 3 questions back to back from MTP Act. So expect this topic to be asked in future PG exams too, be it INI-CT, be it NEET PG. So let us start with MTP Act. The first line which we should remember is whose consent is necessary for doing medical termination of pregnancy. Always remember, it is the consent of the female which matters. And the age of the female should be more than 18 years. What happens if the female is a minor? If the female is a minor, you will take consent from legal guardians. Legal guardian. Like father, mother, they will be legal guardians now of the female. If the female is a minor, otherwise her consent is valid if she is more than 18 years of age. Is husband consent mandatory? Husband ka koi role nahi. Husband has no role in giving MTP consent. Even if the husband does not give consent, the female can go ahead with MTP. But yes, always remember, repeated MTPs without husband consent can become a ground for divorce. Now, what are the important indications? Let us summarize the indications one by one. And one more query which remains in your mind, whether this female should be a married female. Marriage has no relation for MTP. Remember, MTP has no relation to the marital status of a female. Whether the female is married or unmarried, that does not matter to us. What matters to us is age of the female. Okay. If she is a minor, less than 18, take the consent from legal guardians and then you can go ahead with MTP procedure. Under what indications? First indication is for pregnancy up to 20 weeks. The MTP Act says one doctor opinion is sufficient to go ahead with MTP procedure. One doctor opinion is sufficient. And for indications like if there is any serious risk to female or fetus, this indication you will see it will be beyond 20 weeks too. We will see that. Then the second indication, which is only till 20 weeks, is pregnancy occurring due to contraceptive failure, either by female or her partner. See, the word husband itself is not there in the act. Husband को respect नहीं मिली. कहाँ पर? MTP Act. Husband has no respect in MTP Act. Who has got some respect? Partner. Partner is any person. So it is applicable for unmarried females too. So like male contraceptive failure has occurred. The couple comes to the doctor and tells that we were using condoms, but rupture of condoms occurred. The doctor is unaware so as to what has happened at the actual crime scene. But not crime scene, at the scene of act of coitus, the doctor is unaware now. So that whether rupture of condoms has occurred or not. So basically, this new act has increased the scope of MTP. More and more couples will be coming to doctors for MTP. So this is like a loophole in the law. Then come to second indication, and that is why they have decreased the eligibility of doctors. Now more and more doctors will be needed now. So they have decreased the eligibility also, which we will see later on, just after finishing the indications. Now, any pregnancy between 20 to 24 weeks. What are the indications? For any pregnancy between, B/W means between 20 to 24 weeks. Two doctors' opinion is needed. This is how the questions are asked. MCQs are framed. For a 22-week pregnant female, she has come for MTP. How many doctors' opinion will be needed? Two doctors. Okay. Two doctors' opinion is needed. And here we have a list of indications. First indication is if there is any serious risk to female, to fetus. Let us write fetus here, because for females now they have categorized some categories. They have told us some categories of females where MTP can be done up to 24 weeks. So what is that special category of females? Special category of females where MTP can be done up to 24 weeks is if the female comes to the doctor and tells that pregnancy has occurred due to rape offense or any sexual assault or incest also. Incest is also covered. Incest is sexual intercourse between close relatives. Okay. Then another indication is if the female is a minor. Minor means less than 18. Or if the female is mentally challenged female, or I say if the female was having any mental illness. Mental illnesses constitute of psychotic and neurotic illnesses. Psychotic illnesses will be delusion, illusion, hallucination. Neurotic symptoms will be like anxiety, depression. Okay. So mental illnesses are covered. Along with that, mental retardation is also covered. Mental retardation is categorized based on the level of intelligence quotient, IQ quotient. Na? IQ is derived by mental age upon chronological age. That is how we derive the mental retardation categories from profound to mild. So mental retardation is also covered. Next time they can create a question. There is a mentally retarded female, you can do MTP up to 24 weeks. Then, if the female was having any physical disability, which will be certified by concerned authority. So yes, under physical disability also MTP can be extended up to 24 weeks, but on the opinion of 2 doctors. Then they have written, if there is change in marital status of the female during course of pregnancy, like the husband has died, female has become a widow. So this is like change in marital status of the female. So in relation to change in marital status, again MTP can be done for a widow or divorce has happened. So widowhood and divorcehood is covered in relation to change in marital status. Then comes in relation to any emergency declared from the government side or in relation to any natural disaster like earthquakes, cyclones. Basically, they will lead to financial losses. So financial losses are covered in the form of emergency and disaster. Clear? Let me have a look at the YouTube session also if the people are having some queries. So this is the indication up to 24 weeks. Up to 20 weeks, contraceptive failure and any serious risk to female or fetus. Now let us see the third indication and that will end our indications. The third broad indication is if this pregnancy is beyond 24 weeks, we should always remember that now the MTP can be done, but on the opinion of a medical board, because the case was a case of serious risk to the fetus. So there is only one indication which is covered here. If it is discovered by the medical board that the fetus is not going to survive at all. So if there is any serious abnormality or risk to the fetus, so now MTP can be done at any age. See, beyond 24 weeks they have written. Upper limit is not mentioned. So I can remember it like at any age MTP is allowed based on this indication and on the opinion of a medical board constituted by obs-gynae practitioner. Another member will be a pediatrician and third member will be either a radiologist or sonologist. Radiologist or sonologist. And then they have also written in the MTP rules that any other member as decided by the government from time to time can also be added. It's not that these will be the only 3 doctors. Any other member can also become a member of the medical board as decided by the appropriate authority under this act. So this is the indication area. Now, suppose you are a doctor and your indication is fulfilled. You did MTP. Now, what is your role? After doing MTP, you will enter the credentials of the patient. Now, every patient, remember, every patient gets a number. And it is this number which is in public domain. The name of the patient, the details of the patient is not written in the medical records. The patient runs with numbers. And that number is known to the doctor who has done MTP. So everything is in a confidential way. Confidentiality is to be maintained. And all the details of the patient means that number is kept in a sealed envelope. Proper chain of custody is maintained. And that sealed envelope and the entry in the MTP register is preserved for a period of 5 years to be preserved by the head of the hospital. This can become future exam question. The report of monthly report of this register is to be sent to Director of Health Services. These were basically the options of recent FMG exam question. So this is to be done by us only, the doctor who is doing MTP. So doctor should be aware now. So as to I have to preserve the register for 5 years. I have to send the monthly report to Director of Health Services of the concerned district. So this is our duty, which we should remember. Confidentiality of the patient is maintained in the form of, this is what is called professional secrecy. Secrets of the patient being maintained by giving a number to the patient. Now, who can do MTP? That will end our this topic. Who can do MTP? So let us see one by one. In relation to who can do, we will write 4 numbers, 1, 2, 3, 4. Basically, 4 type of doctors can do MTP. First doctor is a doctor who has done MD degree or diploma degree in Obs Gynae, MD or DGO. Basically, in Obs Gynae, they are allowed to do MTP. Yes. Then another group of doctor who is allowed to do MTP is any registered medical practitioner. All of you maximum students who are sitting in the class, they are RMPs. When do you become a RMP? When you complete your final year, then you do your internship. After internship, your degree is registered in your respective state medical council. You become a registered medical practitioner. You have the license to practice. So any RMP with either 6 month, M for month, house surgeonship experience, they are also allowed to do MTP. In which department? Obviously, if you have to do MTP, you have to gain experience in Obs Gynae department. With ortho experience, you won't be allowed to do MTP. So, house surgeonship experience in Obs Gynae department, which is mainly done in government hospitals, government institutions. Or suppose you are working in a private hospital or private nursing home under the guidance of under the supervision of a Obs Gynae practitioner. There you need 1 year experience in any other medical establishment other than house surgeonship experience in Obs Gynae department. Okay. Third group of doctors who is allowed to do MTP is any RMP who has assisted a Obs Gynae practitioner in 25 MTPs, and it was certified by the Obs Gynae practitioner that out of 25 MTPs, the concerned doctor has done 5 MTPs by himself or herself. So out of 25, 5 were done by himself. So this also makes the doctor eligible to do MTPs. And the last group of doctors, which is newly added in our MTP Act. So this will become a potential question area for NEET PG exams, INI CT exams or future exams. What they have written is, because they have increased the scope of MTP, they have decreased the eligibility criteria. How? Sorry. What they have written is, any RMP with 3 or more than 3 month experience in Obs Gynae department in any medical establishment, or any RMP who has done 10 MTPs by medical methods, by prescribing mifepristone and misoprostol under the supervision of a Obs Gynae practitioner. So they are also allowed to do MTP. Now, how the MCQs will be framed? MCQs will be framed like this. For MTP up to 9 weeks, which doctors are allowed or eligible to do MTP? So remember, any of the 4. Any of the 4 means either 1, 2, 3 or 4, which we have seen one by one. So up to 9 weeks, any of the 4 can do MTP. The moment pregnancy is beyond 9 weeks until 12 weeks, only first, second and third means the new category of doctors who have become eligible, they are allowed to do MTP till what age? Till only 9 weeks. This will be asked as question. Then any pregnancy beyond 12 weeks, who will do MTP? Only first and second group of doctors. So MCQ can be framed from either of the 3 lines. I hope it is clear now. The indications, 3 indications and the 4 group of doctors who can do MTP. This is how you have to revise. You have to revise and construct it. Now revise with me quickly. What are the important indications for up to 20 weeks? 1 doctor, if there is serious risk in the fetus or in the female, or pregnancy has occurred due to contraceptive failure either by female or her partner. Pregnancy between 20 to 24 weeks, 2 doctors' opinion, if there is serious risk to the fetus or it is applicable to some special category of females. Pregnancy due to rape, sexual assault or any incest, or if the female is a minor, mentally ill female, mentally retarded female, physically disabled female. So female indications are done. Now if there is change in marital status of the female, like female has become a widow or divorcee, or in relation to any disaster or emergency setting. So on the opinion of two doctors, you can do MTP. And for any serious risk to the fetus, at any age, MTP can be done on the opinion of a medical board, even beyond 24 weeks. Done and dusted. So this covers our second basic definition, that is medical jurisprudence. Let us now move ahead to our third definition. The third definition is of So you two people happy? So let us start with medical ethics. Medical ethics. If you know the correct, accurate content, question can be framed in, let the question be framed in any manner. You will be in a strong position to solve the question. Now, what do you mean by medical ethics? This is defined as moral principles. Remember the word moral principles. Guiding three types of relationships. The relationship between two doctors, the relationship between a doctor and a patient, and the relationship between doctor and state. Now, what do you mean by this? As doctors, we have some responsibility towards law enforcing authorities like policemen. Any suspicious case, we cut MLC, we make it a medico-legal case. This is our responsibility towards the state. This is what is called as medical ethics. Who tells us that which things are ethical and unethical? This is told to us by our National Medical Commission, NMC. So they have created a list of ethical acts and unethical acts. Our MCQs are framed first of all from this definition. Second question area is, what are the important unethical acts which every doctor should remember? And they have also told us that unethical acts are also called as synonyms. I will write equal to. Okay. Unethical acts done by a doctor is also sometimes called infamous conduct by a doctor or professional misconduct done by a doctor. Never confuse this word with professional negligence. Negligence is error done by a doctor. Error can be mild or it can be gross. But this is professional misconduct. Misconduct is conduction of unethical act by a doctor. Now the list of unethical acts is very long, but we have to make our content optimum. So let us remember those important things. So there are 6 A's of unethical acts. Starting with, if a doctor is consuming alcohol during the course of treatment of a patient or during the course of doing surgery of a patient. So yes, this is unethical. After doing your duty, you can consume, but not during the course of your duty. A doctor is found into addiction, like he was smoking ganja or he was smoking charas. So during the course of treatment of a patient, this is not to be done. In fact, consumption and possession of any narcotic agent is a punishable offense in India. When you are caught, it becomes a punishable offense. Always remember. But for we doctors, we should not utilize these things during the course of treatment. Then comes A for advertisement. With regards to advertisement, what they have written is that advertisement obviously can be done by we doctors, but we have to follow the guidelines. So this is mainly the guidelines in relation to opening of a new nursing home or clinic. If you want to advertise about your clinic, what should be the size of the hoarding, and all the guidelines are there. So just follow the guidelines. Advertisement can be done in appropriate manner as told by NMC. Then A for association of a doctor also is unethical. And they have elaborated this association, which is itself a definition based repeat question. They directly framed a question in our NEET PG exams. What do you mean by association of a doctor, or what is true about association of a doctor? So this is defined as covering of unqualified person by a doctor. Covering of unqualified person, like a compounder. The surgeon has given his compounder the duty to give the final skin stitches after conducting a surgery, so as to save his time for another surgery. This is covering of unqualified person. So this is also unethical. Then comes A for abortion. Abortions which are illegal or criminal. and illegal and criminal abortions, they come under. They are offenses in law because you are doing something against the law. When does abortion become illegal or criminal? When MTP Act guidelines are not followed. That is why we doctors should have sound knowledge of MTP Act, so as to safeguard ourselves. And lastly, what they have written is A for adultery. Adultery is a married person having sexual intercourse with someone else's wife without the consent of husband. Obviously, no husband on earth will give consent. There is no purpose of writing that thing. But yes, we should remember that what is adultery, because these laws were made by Britishers in 1860, all the IPCs, and recently in December 2023, the government has almost changed the laws in the form of changing of the numbers. So let me just help you understand. So as to what has basically changed. What has basically changed, like in abortions. If I take this abortion topic now, what has changed in abortion topic? Let me guide you. Just one second. See, now the IPC sections are called as Bhartiya Nyaya Samhita sections. We used to read now that the IPC sections related to abortion are 312 to 316. Correct? What they have changed is the numbers. Now, in the new Bhartiya Nyaya Samhita, what has changed is the numbers. The content is same, almost the same. So what has changed is the numbers. Now we used to read in relation to criminal abortions 312 to 316. In the same sequence, what you have to read now is 88 to 92 in relation to Bhartiya Nyaya Samhita. Okay. The bill has got the signature of our Honorable President, but it has not been notified by the government in the legal gazette, but it will be notified. It will be notified in due course of time. So you should have an idea so as to where the changes have done, at least in the areas which are repeat questions in relation to sections. So time to time, when I will cover sexual offenses now, I will guide you through all the changes in the numbers and wherever some significant thing has changed. Like 88 Bhartiya Nyaya Samhita will now deal with criminal abortion with consent, and 89 will deal with criminal abortion without consent. This is a repeat question of recent NEET PG exam. That death of the mother has occurred during illegal abortions or criminal abortions. This is an offense under. There the answer was 314. Now if the question is asked in relation to Bhartiya Nyaya Samhita, now the answer will become 90. Just the number is changed. Content is same. Then in relation to live birth, preventing a live birth or causing a live born to die after birth. This is now an offense under 91. And causing death of quick unborn child while trying to kill the mother. This is an offense under 92 section of Bhartiya Nyaya Samhita. Correct? So 88 to 92. Instead of, along with that, remember 312 to 316, you have been reading. So we will focus only to those sections which are repeat questions. Okay. So these are the 6 A's which are unethical. So let us fit that 312 to 316 IPCs, or I say 88 to 92. Okay. Bhartiya Nyaya Samhita. I hope all of you understood now the meaning of these new sections. Wherever some significant changes have occurred, that also I will be covering with respect to the chapters. चलो जी आगे बढ़े. Let us move ahead. I have read all the law manuals where the changes have done in relation to CRPCs, IPCs, Evidence Act for you all, and that is how I have prepared all these tables. It has taken a lot of efforts, but yes, your things will become very simple. Then come to the important unethical acts. Let us come back. Alcohol addiction, abortion, advertisement, association, and adultery. After that, also remember, issuing of false certificate by a doctor is also unethical. As a doctor, if you are issuing a false certificate like false birth certificate or death certificate, this is also unethical. Never ever make a false certificate. Then medical dichotomy dichotomy is fee splitting between the doctors. Dichotomy is defined as fee splitting between doctors by unwanted referral. A physician has sent a patient to his surgeon friend just for referral without any need. And someone from the surgeon clinic comes with a thank you letter and a money packet to the physician. What is this? This is how it was asked in one of the FMG exams. The correct answer there was medical dichotomy. So dichotomy is fee splitting. This is also unethical. What will happen if a complaint is made against a doctor that so and so doctor has done an unethical act? The state medical council will do a preliminary inquiry and punishments are prescribed now. So what are the punishments for unethical acts? Punishment for unethical acts. Always remember, the punishment can be given by state medical council, and this is a medical body. It is not a judicial body. Judicial bodies are our courts, honorable courts. So punishment can be given by courts also, which are judicial bodies. So either a medical body or a judicial body can give punishment. What are the powers of courts? Some changes have been done in respect to power of judges and power of courts also, which also I will cover when we will cover that topic. Okay. Now, courts have fine power, we know, and they can send an accused to prison, imprisonment power, like for criminal abortions, because they are offenses in law also. So courts will also give punishment to the doctor. State medical council can also give punishment. What are the powers of a state medical council? They can either give warning to a doctor to not to repeat the offense if the offense was mild in nature, or they can directly erase the name of the doctor, called as penal eraser of the name of the doctor can be done from a state medical register. Means your license to practice is revoked or gone. This penal eraser can be temporary, like for 1 month or 1 year or 2 year or 3 year or 5 year, or it can be permanent, lifelong. Permanent is like the most severe punishment given by state medical council. So permanent penal eraser is also called as professional death sentence. This is a repeat question. What do you mean by professional death sentence? Professionally, the doctor is dead. His license to practice is gone because his degree is gone. Let me give you one example so that you understand. 1 or 2 examples. Like you must have read that in relation to illegal transplantation, if a complaint is made and if the doctor is found guilty, so we have a transplantation act now. Like kidney racket was maintained by a doctor and his friends. So complaint is made, inquiry is done, he is found guilty. Now what is the punishment? The state medical council, for the first time, they will erase the name of the doctor. They can erase the name of the doctor for 3 years. But suppose the doctor, after 3 years, his license to practice is reinstated and he is again involved in illegal transplantation. Now, professional death sentence. This is how it goes. Directly, permanent penal eraser is not done. So this is like temporary penal eraser, and professional death sentence will become permanent penal eraser, like that. And similarly, the doctor will also go to prison. Fine provision is also there under Transplantation Act. So they will be like judicial powers. I hope it is clear. Now, where can the doctor appeal? Suppose the doctor finds that he is innocent. He has evidences to prove this fact. So now, appeals against State Medical Council, this is also a repeat question. Against State Medical Council decision is made to which of the following? Earlier, the answer to this question before 2019, 2019 से पहले, the answer used to be Central Health Ministry. But in 2019, NMC was established, and under which 4 boards have been established. And one of the board is EMRB, to which the appeals will go now. EMRB stands for Ethics and Medical Registration Board. Ethics and Medical Registration Board. So the appeals are now made to EMRB. Okay. If the matter is settled, well and good. If the matter is not settled, now EMRB will hand over the case to NMC, and the final decision will be taken by a new board of members constituted by NMC, and they will take the final decision. But if the question is the first time the appeals are made to which of the following? EMRB. If the matter is not settled, the final decision is taken by NMC. Like that. I hope it is clear. So this covers our three basic important definitions. Now come to the fourth definition, that is of medical etiquettes. Medical etiquettes. Etiquettes का simple मतलब होता है, the dictionary meaning is courtesy. Etiquettes means courtesy. Ethics means moral principles. So this is like courtesy should be there between doctors. In our medical fraternity, we should be showing courtesy to our colleagues, to our juniors, to our seniors. It should be like a very conducive environment. So this is what is called medical etiquettes. But suppose the doctor is not showing courtesy. Can you punish the doctor? Answer is no. So I can create a MCQ out of this. Breach of which of the following is non-punishable? So breach of etiquettes is non-punishable. Non-punishable. Like your junior has come with his parents to you for checkup, regular checkup, and you are charging the money. This is, you are not following the etiquettes. If you are not charging the money, you are following the etiquettes. But for that breach, no one can punish you that you are taking the fees and all. Okay. But we should as members of medical fraternity. So this covers our fourth definition. Come to fifth definition, that is of professional secrecy. Professional secrecy simply means it is the obligation of every doctor to keep secret all information of a patient which you come to know during course of treatment of the patient, Okay. So professional secrecy should be maintained by we doctors. If you do breach, again it can become an unethical act, and it can be like patient can also file defamation case against the doctor. So professional secrecy is to be maintained, but there are some exceptions to professional secrecy. Exception to professional secrecy I can write as PS, not police station. PS here stands for professional secrecy. So exception to PS is called as PC. PC will be elaborated as privileged communication. So there are certain conditions where a doctor is privileged to communicate the information of the patient to certain individuals and to certain authorities. What are the important situations where a doctor can communicate about the patient? Let us see. This privileged communication consists of certain conditions where a doctor can communicate, like C for crime. During the course of treatment of a patient, you come to know that the patient has killed his wife. So you will inform the police authorities. This is not like you are breaching professional secrecy. I for if the patient is having any infectious disease, or I can write V. V for venereal disease or sexually transmitted diseases. You will inform the family members, or if the person is a married, you will inform the spouse that so and so fellow is having some infectious and venereal disease, so please take care. Then I for in patient's interest, and C for court of law. So this makes it civic. In patient's interest, like patient was having suicidal tendencies, obviously you will inform the family members to take care of this fellow nicely. Court of law means if the patient has taken the doctor and the hospital to the courts for some or the other reasons. Now as doctors, we can disclose all the information of a patient to prove our innocence. So this makes it civic, and then comes sin. That completes your mnemonic, as civic, sin are important conditions of privilege communication. Let us elaborate the sin also. Here S stands for servant and employee. servant and employee. A very good example given in Reddy is a train driver has come for regular eye checkup, and this train driver was incidentally found to be colorblind by the railway hospital doctor. As a doctor, you will inform the railway authorities that so and so person is a train driver and he is having now color blindness. He cannot see red and green signals. So it is our legal ethical duty. If you don't do so, again it will become unethical. Getting the point? So privileged communication are those conditions where a doctor should inform the authorities in certain situations like this. Then I stands for in self-interest. We doctors can disclose the information of a patient, like for negligence cases. Patient has filed a negligence suit against the doctor. Now, in consumer courts, you can disclose all the information of a patient to prove your innocence. And N for notifiable diseases. Notifiable diseases are like yellow fever or COVID. The moment a case becomes yellow fever positive or COVID positive, we have to inform the municipal corporation department so that public health control measures can be taken. If you don't do so, again, you are committing, you are doing an unethical thing. So this is expected. This is our duty which we have to do. So privileged communication is like a duty which we have to do. I hope it is clear. So this wraps up our definition area. The important definitions being definition of FM, medical jurisprudence, ethics, etiquettes, professional secrecy, PS, and exception to PS becomes PC. Simple. So these are 6 important definitions from where questions are picked. Now let us come to some miscellaneous definitions here and there. In last 10 years, the definitions which have been asked, let us summarize them. So Telegram group people, you are there now? All of you are getting the point now? Is my speed correct? Or do you want to increase it or decrease it? I think the speed is optimum. Actually, at 2 places I have to cater the queries. So here I am getting the queries in the form of not getting the link. The process has not started. So those who have started, those whose systems are working, I hope you all are able to acknowledge the things which we have covered till now. Just let me know quickly. Anyone? So let us cover our miscellaneous definitions then. Okay. Thank you. Thank you. So let us start with our miscellaneous definitions. Like in 2014 All India exams, what was asked was, what do you mean by filicide? Filicide. So remember, filicide means deliberate killing of one's own child. Deliberate killing of one's own child by parents. Basically correlates with your battered baby syndrome. Battered child, psychotic parents beating their own child. But if they cause killing of their own child deliberately, this in one word is also called filicide. Remember this. Then in relation to multiple pregnancy and different types of child deaths, there are some terms. So like, I will give you a case scenario that suppose one day a female comes with 2 kids. Okay. A female has brought 2 kids and she is of the opinion in one scenario, number 1 scenario, that they are twins. You are saying that they are twins. They are look alike, age is same, ek jaise dikh rahe. In another scenario, what you are seeing is that they are of different age. Okay. And what is the opinion of this female? That these 2 kids belong to a particular male. हो सकता है फंसाना चाह रही हो सकता है real father. Okay. Now it has to be derived by the policeman. whether this alleged male is the father of the kids or not. So in the first situation, what will be taken? The blood of the male and the blood of the kids, and DNA analysis will be done. And that DNA analysis, the blood sample is taken in which preservative? Answer quickly. For DNA analysis, the blood is preserved in which preservative? Sodium fluoride or EDTA? Answer. For DNA analysis, the blood is preserved in, always remember, EDTA. EDTA coated vials, because they inhibit growth of microorganisms in the sample and the sample is not destroyed. The efficacy of DNA analysis is maintained if we use EDTA, which are lavender colored vials. This is your EDTA coated vials, na, lavender colored vials. Okay. So they are used for keeping the blood sample for DNA analysis. Now DNA analysis was done. The result was both kids belong to male. Means the DNA analysis of both the kids belong to the male. So my opinion will go with yes, they are twins. They are real twins. And the male is the actual father of both the kids. So this is like twin delivery case. But if I write that male is father of one kid, what is this condition called as? Answer. कौन बताएगा? This is your question of the day. The scenario I have given you. Now you need to put your answers. बताओ जल्दी. Male एक kid का father है. दूसरे kid का नहीं है. What is this condition called as? In one word. This was our repeat question of All India exams. What is this condition referred to as? I will give you options. Superfecundation or superfetation? This is what is called as superfecundation. So let us write. This is what is going to be called as superfecundation. So what is superfecundation? Let us understand. There were two fertilizations which happened in the same menstrual cycle by different act of coitus. Different act of coitus. That is why in the question lines you will see the word twins, or you will see both the kids are of same age. Why they are of same age? Because the event of fertilizations, they are happening in the same menstrual cycle. But if the act of coitus is different, like this is also not possible in humans, but very rarely can be seen in some females who were under ovulation treatment. Ovulation induction agents were being given. So there another fertilization might occur very rarely. Superfecundation rarely is possible. Okay. But this is how the question is framed. But if the question is like the kids were of different age, and I write here that the inference is male is father of one kid. Now your answer will go with superfetation. What is superfetation? Fetus के ऊपर fetus. Means one fertilization gave rise to one fetus. Another fertilization in another menstrual cycle. That is how the age of the fetus will always be given as different. अगर मेल दोनों किड्स का फादर होता तो वो तो एक्चुअल फादर हो जाता, वो तो क्वेश्चन ही फ्रेम नहीं हो सकता. That question cannot be framed. But for framing the question, remember this term, which is impossible in humans. Normally in females, in humans, after fertilization, primary amenorrhea occurs. But what do you mean by fetation? Female is still ovulating. Even after one fertilization, in January month, the fertilization occurred. After 1 month in another menstrual cycle, instead of primary amenorrhea, she is still ovulating and getting fertilized. What is that product called as? Superfetation. So because the act of coitus is different, father might be different, both in superfecundation as well as fetation. I hope it is clear. Then another scenario. I say that DNA analysis result was like Male is not the father of any. Father of both. Now, what do you call such child as? Where a female brings kids, alleging a male to be the father, but the male is not the father of both or either of the kids. Such child is called as supposititious child. Another repeat question of our exams. Supposititious child is also sometimes called as fictitious child. These are all definition based questions which have been asked in our exams. These are all repeat questions of one or the other exam. So in a nutshell, remember this scenario and any question from this area will be solved very easily. I hope it is clear. So remember the name supposititious child, fictitious child means the same. Remember the word superfecundation, superfetation and twins, and how we have to differentiate we know. And this is itself a repeat question. Blood for DNA analysis is sent in which preservative? The answer goes with EDTA. Routinely we preserve blood for toxicological analysis in sodium fluoride. But for DNA analysis, the blood is preserved in EDTA coated vials, lavender colored vials. Correct? चलो जी आगे बढ़े. Let us move ahead. So this wraps up our definition based areas. Now we will start with the legal systems, legal procedures, all those aspects with the help of one story, which I quote in maximum of my classes. So I will quote that same story. This story, these are all my stories. These are all summons which have been received by me, and you will see the name of the witness. My name is written, and a particular date and a particular time is written that you have to come at so date at so time in Karkarduma Courts, Delhi to record your evidence. So let us take this summon. So the name of the witness is written, the name and the records of the honorable court and the judge is mentioned, and their signature is there in this copy, legal copy called as summon, which is given to a witness that you have to come to courts on this date at this time. And this is a case where a crime has been done against the state, ST for state versus Vinod Kumar. So let us learn few things about this case, and we will correlate this story to cover all the types of evidences, witnesses, everything. So this is a story of state versus, let us write the word accused here. Okay. Our Indian legal system, as made by Britishers, which is still till date the same, recently the numbers have changed and many of the sections have been removed, and few things have been added in our laws. Why the new laws have been made? Because few things have been made a punishable offense which were not there earlier clearly mentioned. Like someone has snatched your mobile. Earlier police was not finding any particular section for this, but now they have made this an offense as petty organized crime. Then they have written like someone is circulating fake notes, it will come under organized crime. So they have used the word organized crime, petty organized crime, terrorist act, all these things in our new laws. And the sections which were not needed, they have been abolished. So the number of total IPC sections have been reduced. More than 100 sections have been abolished. But the sections which are important for us are sections related to sexual offenses, sections related to abortions, and sections related to injuries. With respect to the concerned chapters, I will be covering the recent changes too. Now let us come to the story. What is our Indian legal system? Indian legal system says that every crime is a crime against the state. And it is the state which is telling, which has made a complaint that so and so person is the accused who has done a crime. The law says accused is innocent unless proven guilty. Who needs to prove the guilt of the accused? The victim side. The victim side or the state side. So this is what is called as burden of proof. So the meaning of this word should be very clear. What do you mean by burden of proof? It simply means burden of proving the guilt of the accused, also called as onus of proof. So according to our Indian legal system, which is an adversarial system, The burden of proof usually lies on the accused. Okay, I hope it is clear. Now let us come to this story. This story is of this accused who comes to his house at about 11 o'clock in the night in an alcoholic state. Alcohol is mostly absorbed from which part of GIT? Stomach or intestine? Answer. Ethyl alcohol is absorbed mostly from stomach or intestine. What will be your answer? पहले तो ये बताओ. पीते तो हैं बट एब्जॉर्ब कहां से होता है ये क्वेश्चन है, तो ये पता होना चाहिए. मेजर रोल इज प्लेड बाय इंटेस्टाइन्स. पानी सबसे ज्यादा एब्जॉर्ब किधर से होता है? एब्जॉर्प्शन ऑफ द वाटर which we have taken, which we have consumed. Maximum role is played by jejunum. Alcohol is like water, so that is why intestines. Some role is played by 20% role is played by stomach. 80% role is played by small intestines. So he consumed alcohol and then he reached his house at about 11 o'clock in the night. In the alcoholic state, he starts fighting with his wife. At about 12 o'clock, under high temperament leads to wrong things. So what he did was he took a heavy sharp edge weapon like an axe and killed his own wife by producing 3 big chop wounds. The female died on the spot. Then he brought the dead body from the 3rd floor through stairs. There was no lift in the society. He used to live in DDA flats. DDA flats in Delhi, they don't have any lifts. So he brought the dead body from 3rd floor to ground floor through stairs and thereafter kept the body corresponding to the balcony of his house. What was he planning to create? A case of fall from height. What he should have actually done? He should have made it a case of fall from height, actual case. But he brought the dead body through the stairs and kept the body corresponding to the balcony. And then he called Delhi police. This took him about 2 hours to manipulate the findings. Then at 2 o'clock, Delhi police constable came and he made a diary entry that so-and-so female has fallen from balcony of the house on 3rd floor. In the morning, by chance, I was on duty in GTB hospital, Delhi, in mortuary. So sub-inspector was given the case. He was the investigating officer of the case. So before starting autopsy, how do we start autopsy? We get the inquest papers from the investigating officer. That can be a policeman, that can be a magistrate, okay, the signing authority, depending on whether it is police inquest or magisterial inquest. So we will cover the different types of inquest which is followed in our country and few types which are followed in other countries in addition to inquest topic. So the policeman makes a request for autopsy to be done and he submits the medical legal documents to us. So before starting autopsy, the dead body is identified by 2 known relatives. So this Vinod Kumar, he brought his brother to identify the dead body. What has he told the policeman? That it was a case of fall from height till now. Till I have seen the papers. I have not seen the dead body yet. So during the time of identification, we doctors also stand along with the policeman while the dead body is getting identified. This is a sort of consent of the relatives. So do we take consent before autopsy? Yes. Who takes the actual consent? The policeman. They make the relatives sign the documents and all, and that is given to us. So at the time of identification, when I entered the mortuary hall, GTB mortuary is fantastic. You will if you have time now, go sometime. You will love it. It is like a world-class mortuary. So the moment the dead body was seen by me, I saw 3 big chop wounds. I told the SI, this is not a case of fall from height. These are chop wounds. Chop wounds are produced by heavy sharp edge weapon asked in our exams that correlate the type of weapon and type of injuries. In one option, it was given axe. In another column, it was given chop wounds. Yes, I will match it. And I will tell the policeman that this is a injury produced by a heavy sharp edge weapon. This cannot be a case of fall from height. In a case of fall from height, what will be the presentation? Suppose the female actually fell from the 3rd floor and she has landed on his feet. She will get lots of injuries over the body, abrasions, bruises and lacerations, blunt injuries, not sharp weapon injuries. Plus there can be fracture of foot bones and the pressure is very large. So it will transmit upwards along vertebral column. It can cause damage of thoracolumbar vertebra. The transmitted pressure was so large that it transmitted to the base of the skull and can cause fracture around foramen magnum. What is that called? Ring fracture. So in a case of fall from height, if the victim lands on feet, this is itself a repeat question. Which is correct about fall from height cases? So the correct answer was fracture of thoracolumbar vertebra and ring fracture. So yes, this can happen if the person lands on feet. If the person lands on head, multiple comminuted fracture of the skull vault. That is also correct. Forensic is a thing to understand with stories. So this is not to mug up. This subject, very few things are to mug up, like the sections and all. Rest, all things are to understand. So we are trying to develop that insight and understanding. So till now, this Vinod Kumar is of the opinion that it is the case of fall from height, but with my insight, the case is going to be a homicidal case from an accidental case. Originally, it was an accidental case, na? Fall from height are accidental cases. But homicidal case is like murder cases. Killing of someone has been done. So a case of accident now turns to be homicide. This is what is FM. This is what is our role. Application of medical science knowledge, knowledge of injuries, to tell the policeman that this is not an actual case which the relatives are saying. This is our role, to give justice to the victim. So now the case will go to courts. There is a victim side, there is a accused side. Victim side will get a lawyer from the courts called as public prosecutor. They are lawyers who are appointed in the courts to take over the victim's case. They are on a salary basis in the courts. The accused will hire a private lawyer. Suppose the accused was very poor and he is not able to hire a private lawyer. Now the courts will give him a lawyer too. Courts can give him a lawyer under certain conditions if his financial status is very low and all that. But that affidavit have to be given by the accused. But usually the accused people, they hire a private defense lawyer who will defend them. So the matter will go to courts. But let us stop here. Let us come back again. Let us come back again and let us start writing few things. In relation to, write this word evidence in the center of your notes. And let us see the types of evidences acquired outside courts. Evidences can be acquired by general public, and in law that general public is called public witness. Evidence can be acquired outside court by public witness. By this mechanism, I can say evidence can be categorized into something which is directly related to the crime and something which is indirectly related to the crime. So called as direct evidence or indirect evidence. Direct evidence is acquired by either a common witness. Who is a common witness? Eyewitness of the case. Who is an eyewitness? A person who has seen the crime occurring. So obviously, any such witness will always have first-hand knowledge about the crime. A repeat question. Which types of witness will have first-hand knowledge about the crime? Always common witness. Then there can be other witnesses like us. With my expertise, I looked at the injury is a chop wound over his scalp. So yes, the weapon should be a heavy sharp edge weapon. Because the weapon is a heavy weapon, the force used is also heavy. So with my knowledge or expertise, my findings in the autopsy report will be admissible in the court. I will become expert witness for those findings. So direct evidence, common witness, which type of evidence he will acquire? Direct evidence. So remember, direct evidence is acquired by either in relation to a crime. Same things are called circumstantial evidences. And our Indian court will be admissible in courts. Floor. This is admissible in the courts. Another type of indirect evidence is something which has been heard in relation to a crime. Hearsay stand courts. Routinely it is in something. But if I say that something has been heard at the time of death of the person, the stand of our honorable court says, this thing which has been heard at the time of death, we will admit as an evidence, because no one speaks lie. कोई झूठ नहीं बोलता डेथ के समय. No one speaks lie at the time of death. Video is buffering. Everything is okay from my end, All of you refresh your systems. All of you refresh your system, please. Now it is okay. I'm giving you some time so that your system is settled and then we will start. Refreshed. I hope it is okay now. I will repeat from indirect evidences part. ठीक है, not to worry. अपनी सारी परेशानी मुझे दे दो, बट अपने माइंड को एकदम क्लियर रखो, फोकस्ड एंड स्ट्रीमलाइंड एज फार एज माय सब्जेक्ट इज कंसर्न. ठीक है. So in relation to indirect evidences, what we have read is it can be divided into two broad categories: circumstantial and hearsay evidences. Circumstantial evidences are something which has been seen in relation to a crime. Seen things are admissible in courts. Court's stand is that we will admit this statement of the person that I have seen this Vinod Kumar bringing the dead body through the stairs to the ground floor. This is admissible in the courts. Something which is heard in relation to a crime is routinely inadmissible in courts. But what they have written is there are few situations where something has been heard from the victim at the time of death. Just near to the time of death, you have heard something. So those exceptions can be summarized as, अच्छा डायरेक्ट से ही खत्म हो गया. चलो एक बार रिवाइज कर लेते हैं. ठीक है. Let us start from here. We have written this word evidence. Evidence can be acquired outside courts by public witnesses in relation to a crime. Evidences are also presented by witnesses inside court when they are called by the courts after sending a summon. We will come to that part later on. Let us focus towards evidence has been acquired outside courts by a public witness, general public. So general public can acquire direct evidence or indirect evidence. Direct evidence is acquired by which witnesses? Either a common witness or a expert witness. Who is a common witness? Any person who is an eyewitness of the case or who has seen the crime occurring, like the act of killing being seen by a person. He will become a common witness of the case. Which type of evidence he will acquire? Direct evidence. Which type of knowledge he will have? First-hand knowledge, because he has seen the crime occurring. Another type of witness are we people, forensic people. We are expert witnesses for our autopsy findings. So we have also gathered which evidence in relation to a case? Direct evidence. Like my reporting of chop wounds over head will be accepted by the courts as direct evidence. That yes, initially it was an accidental case. Now it is a homicidal case based on these findings. Now come to indirect evidences. Indirect means something which is indirectly related to the crime. Indirect things can be something which has been seen indirectly or something which has been heard indirectly. Seen things are called as circumstantial evidences. Heard things are called as hearsay evidences. Circumstantial evidences are admissible in courts. Hearsay evidences are inadmissible in courts. With two important exceptions. What are the exceptions? I say that something has been heard by me at the time of death. Something has been heard by me at the time of death, which can be either a dying declaration. The victim was trying to tell me something. I have written that statement of the victim on a paper. That paper or recorded document will be called as dying declaration of the dying person. And no one speaks lie at the time of death. So that is why dying declaration becomes admissible in our courts. So what is dying declaration? This is the voluntary statement of a dying person. This is defined as voluntary statement of a dying person. Then another exception is something which has been heard at the time of death involuntarily. Victim was crying and saying, my husband is going to kill me, please save me. One of the neighbors heard this thing and thereafter the victim was found dead. If the neighbor comes to the court and tells the courts these findings, Courts will take a stand, the judge will take a stand and will tell the lawyers that yes, let us admit this as an evidence called as res gestae. What is res gestae? This is like involuntary statement of a dying person which has been heard by someone. So involuntary statements are also admitted. Involuntary statement or involuntary exclamations, they are also admitted as res gestae. But when will dying declaration become inadmissible? If I say that the victim made a statement but thereafter death did not happen and the victim survived. Now the courts will call the victim to the courts to record their oral evidence. Oral evidence always will have a higher weightage than documentary evidence like dying declaration. Why? Because during oral evidence, cross-examination of the witness can be done. But still the dying declaration can play a corroborative role. So let us write this line. If victim survives, what happens to dying declaration? Dying declaration routinely becomes inadmissible in courts because now the person is not dead. So, but still, it can play a corroborative role. Corroborative role means it can be used by investigating agencies to solve the crime. Like for example, the victim told the police officials or the doctor that my husband killed me with an axe and he tried to kill me with a weapon and the weapon has been hidden in the house at so-and-so place. Victim survives after giving this declaration. Police goes to the crime scene, recovers the weapon. Over the handle of the weapon, they find the fingerprint of the accused. Over the blade of the weapon, they find the blood of the victim. Very good corroboration. The weapon used to commit the crime has been recovered by the police. This is what is called corroborative rule. But routinely, that statement becomes inadmissible because now the victim will be called to the court to record their oral evidence. I hope it is clear. So this covers our evidences acquired outside courts. Now what will happen? All these witnesses will be called to the courts by sending a summon. Evidence inside courts is divided into oral and documentary. Oral and documentary. Oral evidence always has a higher weightage. High weightage. Why? Because cross-examination of the witness can be done. So what is this oral evidence recording? Let us cover that. Oral evidence recording. Recording means videography is not being done. It is being recorded in front of a supreme authority, that is the judge, and in the presence of legal representatives like the lawyers and the two sides. Evidence is being recorded on a paper, court paper, bond paper. This is what we mean by evidence recording. So when the witness, now in the courtroom procedure, let us switch on to courtroom procedure. Always remember, in relation to this crime, the story which we have covered, the judge, honorable judge, will ask the lawyers. So basically there are two sides to any crime. One is a victim side, other is a accused side. Victim lawyer is called public prosecutor or PP. The accused lawyer is called defense lawyer. So this is like the constitution of the courts. In the center is the judge. On two sides, one side is the victim being represented by a public prosecutor or sarkari vakil, and accused side being represented by a defense lawyer. Now this judge will ask the lawyers to present the case. The public prosecutor will say that I want to call a common witness and an expert witness like Dr. Vishwajeet Singh to the courts. So we witnesses will be called to the courts. How? By this judge. This judge will issue summon to witnesses. He will issue summon to all the witnesses of different lawyers, be it public prosecutor, be it defense lawyer. He will call his few witnesses. He will also call his few witnesses. So judge will issue summon to all the witnesses, concerned witnesses. Now the witnesses have come to courts and their evidence will be recorded. There will be a person who will type all the things which we are telling by our mouth. This is called oral evidence being written in the form of oral evidence recorded. Okay. So I have made the autopsy report. I will tell my autopsy findings in a gist manner. That these are the injuries which led to death of the person, and this is my final opinion in the form of cause of death and times his death, as per my post-mortem report. So now my evidence is being recorded, but how it happens? Once as a witness, suppose taking me as a witness, I have gone to Karkar Duma Courts, Delhi. The lawyer who has called me is public prosecutor. What am I for? I am there for giving justice to the dead, giving justice to the victim. So the lawyer who has called me is public prosecutor. He has got rights to do my examination first. What is that examination called? Direct examination. Also called as examination in chief. It's not that he will give me a paper that solve the MCQs. It's not like that examination. The examination which you are going to give on 7th of July. The lawyer will examine me in the form of, he will tell the courts that Dr. Vishwajeet has come to the courts. Let us understand the autopsy findings which he has mentioned in his postmortem report. I will see my postmortem report and I will tell the concerned person, he will type it and it will be printed on court's bond paper. So my examination is done. This is what is called examination in chief. So it is done by lawyer who has called the witness. It is done by lawyer who calls the witness. So he has got the rights to examine his witness first. Thereafter, the opposite lawyer comes into action, and that action is called cross-examination. Cross-examination is done by opposite lawyer, and vice versa it will go. Like suppose there is a witness called by defense lawyer, his examination in chief will be done by defense and cross will be done by public prosecutor. I have been called by public prosecutor, my direct is done by public prosecutor, cross is done by defense, vice versa. It is done by opposite lawyer. And here two questions are repeatedly asked. That leading questions are normally allowed during which part of examination of a witness? And we all know leading questions are normally allowed during cross-examination part. What are leading questions? Questions which are answerable in yes or no manner. Have you seen the crime occurring? The witness says yes. This is the leading question. Then comes another important thing, that there is no time limit for cross-examination part of a witness. There is no time limit. Then third part of examination, which is rarely needed in certain cases, this direct examination being done again, so called as redirect examination. Sometimes the witness is trapped in leading questions. So now the lawyer who has called his witness, he will try to clarify those facts. So he can do a redirect examination again by the first lawyer. And all the judicial proceedings are being heard by the judge and being noted by the judge. So he can ask certain questions from the witnesses. Those questions are called court questions. So court questions are questions asked by judge. And when can a judge ask question? At any time, be it direct examination, cross-examination, redirect examination. Questions can be asked by judge at any time of judicial proceeding from any of the witness. Like in my case, I was asked 4 or 5 questions. That is it a case of fall from height according to you? I clearly gave in written, no, this is not a case of fall from height based on the presentation of the injuries over the forehead in the form of chop wounds. What is the weapon most likely used to commit the crime? I told that it is a heavy sharp edge weapon and most likely it should be an axe, and actually in that case it was an axe, as confessed by the Vinod Kumar himself that yes, he used an axe to kill his own wife. So all these questions are called court questions. I hope it is clear. The evidence, witnesses, courtroom procedure, everything is summarized. This is how you have to memorize it, and it becomes very easy to recall in the exam if you learn like this, in this manner. Otherwise, if you try to mug up the types of evidence, type of witnesses, it becomes cumbersome and you won't be able to recall it in exam. But remembering it with this story, it becomes very easy. Any queries till now? Any queries till now? YouTube people and Telegram people, you are free to ask any doubts or queries which you have in your mind. till now in the topics which we have covered. Right now we will take a break, short break, and then we will start with our further topics. So after break, we will start with the types of courts and the concerned changes which have been done recently. Then after types of court, we will cover types of inquest, and that will summarize our legal aspects. कोई doubt नहीं? Everything understood? Chalo. So these are the areas from where MCQs are framed from legal systems. Few things are left like court powers, which we will cover after a break. Who commonly have burden of proof, accused or victim? The simple answer is always victim. Burden of proof means burden of proving the guilt of accused. Why? Because the court's stand is accused is innocent unless proven guilty. Who needs to prove the guilt of the accused? The victim side. Because it is the victim who has made a complaint now that so and so person has done a crime. So you will have to prove that with evidences. Merely you saying that my friend has caused injury to me does not make your friend as accused. You need to prove his guilt with evidences. This is what is called burden of proof. So always lies on the person who is the complainant, and complainant is always a victim, usually a victim. Understood now? Chalo, to let us take a short break for it's 10:35. 35, 10, 10:50, 15-20 minutes short break, and then we will start at 10:55. Okay, 20 minutes is fair enough, and after this we will directly take a lunch break around 1 o'clock. Okay, so we will start at 10:55.